10 lifestyle changes to control high blood pressure without medication. If you have high blood pressure, you may wonder if medication is necessary to bring the numbers down. But lifestyle plays a vital role in treating high blood pressure. Controlling blood pressure with a healthy lifestyle might prevent, delay, or reduce the need for medication. Here are 10 lifestyle changes that can lower blood pressure and keep it down. Lose extra pounds and watch your waistline. Blood pressure often increases as weight increases. Being overweight also can cause disrupted breathing while you sleep, which is also known as sleep apnea, further raises blood pressure. Weight loss is one of the most effective lifestyle changes for controlling blood pressure. If you're overweight or have obesity, losing even a small amount of weight can help reduce blood pressure. In general, blood pressure might go down by about 1 millimeter of mercury with each kilogram of weight lost. Also, the size of the waistline is important. Carrying too much weight around the waist can increase the risk of high blood pressure. In general, men are at risk if their waist measurement is greater than 40 inches, and women are at risk if their waist measurement is greater than 35 inches. These numbers vary among ethnic groups. Ask your healthcare provider about a healthy waist measurement for you. Exercise regularly. Regular physical activity can lower high blood pressure by about 5 to 8 millimeters of mercury. It's important to keep exercising to keep blood pressure from rising again. As a general goal, aim for at least 30 minutes of moderate physical activity every day. Exercise can also help keep elevated blood pressure from turning into high blood pressure or hypertension. For those who have hypertension, regular physical activities like walking, jogging, cycling, swimming, or dancing can bring blood pressure down to safer levels. Another possibility is high-intensity interval training. This type of training involves alternating short bursts of intense activity with periods of lighter activity. Strength training also can help reduce blood pressure. Aim to include strength training exercises at least 2 days a week. Talk to a healthcare provider about developing an exercise program. Eat a healthy diet. Eating a diet rich in whole grains, fruits, vegetables, and low-fat dairy products, and low in saturated fat and cholesterol can lower high blood pressure by up to 11 millimeters of mercury. Examples of eating plans that can help control blood pressure are the dietary approaches to stop hypertension or DASH diet and the Mediterranean diet. Potassium in the diet can lessen the effects of sodium on blood pressure. The best sources of potassium are foods such as fruits and vegetables rather than supplements. Aim for 3,500 to 5,000 milligrams a day, which might lower blood pressure 4 to 5 millimeters of mercury. Ask your care provider how much potassium you should have. Reduce salt in your diet. Even a small reduction of sodium in the diet can improve heart health and reduce high blood pressure by about 5 to 6 millimeters of mercury. The effect of sodium intake on blood pressure varies among groups of people. However, a lower sodium intake, that is 1,500 milligrams a day or less, is ideal for most adults. To reduce sodium in the diet, follow these steps. Read food labels. Look for low-sodium versions of foods and beverages. Eat fewer processed foods. Only a small amount of sodium occurs naturally in foods. Most sodium is added during processing. Don't add extra salt. Use herbs or spices to add flavor to your food. Cook. Cooking lets you control the amount of sodium in the food. Limit alcohol. Limiting alcohol to less than 1 drink a day for women or 2 drinks a day for men can help lower blood pressure by about 4 millimeters of mercury. Drinking too much alcohol can raise blood pressure by several points. It can also reduce the effectiveness of blood pressure medications. Quit smoking. Smoking increases blood pressure. Stopping smoking helps lower blood pressure. It can also reduce the risk of heart disease and improve overall health, possibly leading to a longer life. Get a good night's sleep. Poor sleep quality, like getting fewer than 6 hours of sleep every night for several weeks, can contribute to hypertension. A number of issues can disrupt sleep, including sleep apnea, restless leg syndrome, and general sleeplessness or insomnia. Finding and treating the cause can help improve sleep. However, If you don't have sleep apnea or restless leg syndrome, follow these simple tips for getting more restful sleep. Stick to a sleep schedule. Go to bed and wake up the same time each day. Try to keep the same schedule on weekends. Create a restful space. That means keeping the sleeping space cool, quiet, and dark. Do something relaxing in the hour before bedtime. That might include taking a warm bath or doing relaxation exercises. Avoid bright light, such as from a TV or computer screen. Watch what you eat and drink. Don't go to bed hungry or stuffed. Avoid large meals close to bedtime. Limit or avoid nicotine, caffeine, and alcohol close to bedtime as well. Limit naps. For those who find napping during the day helpful, limiting naps to 30 minutes earlier in the day might help nighttime sleep. Reduce stress. Long-term, chronic emotional stress may contribute to high blood pressure. However, more research is needed on the effects of stress reduction techniques to find out whether they can reduce blood pressure. Monitor your blood pressure at home and get regular checkups. Home monitoring can help you keep tabs on your blood pressure. It can make certain your medications and lifestyle changes are working. Home blood pressure monitors are available widely and without a prescription. Get support. Supportive family and friends are important to good health. They may encourage you to take care of yourself, drive you to the care provider's office, or start an exercise program with you to keep your blood pressure low. If you find you need support beyond your family and friends, consider joining a support group. This may put you in touch with people who can give you an emotional or morale boost and who can offer practical tips to cope with your condition. If you are new to this channel and found this information useful, then please like and subscribe for our future updates. Together, let's claim our life back and let the healing begin.